Hello, I'm Dr. A from LifeCare Pet Hospital. If your dog has recently started limping, struggles getting up after resting, hesitates on stairs, or seems less active than normal, one possible cause could be a torn cranial cruciate ligament, often called a CCL tear. Today, I would like to explain what this injury is and how TPLO surgery can be a good fit for your dog and how the TPLO surgeries help many dogs return to a comfortable and active life. Dogs and humans both have a ligament inside the knee called the cruciate ligament. In people, it's called ACL because we are on our 2 feet and we are anterior posterior. In dogs, we call it the cranial cruciate ligament or CCL because they are on their 4 and they are called cranial and caudal. Its job is to keep the knee stable whenever the dog walks, runs, jumps, or plays. This ligament connects the thigh bone, called the femur, to the shin bone, called the tibia. Every time your dog takes a step, these ligaments help prevent the knee from sliding abnormally. It provides that stability to the knee. Inside the knee, there are 2 additional structures called menisci. Think of these as shock absorbers or cushion between the bones. They help distribute weight and protect the joint. As the ligament continues to fail, the shin bone begins to slide forward every time the dog places weight on the leg. We call this a cranial tibial thrust, as you will see in this animation. One way to think about it is like a car parked on a hill. The cruciate ligament acts like the parking brake. Once that parking brake fails, the bone wants to slide every time the weight is applied. That instability leads to pain, inflammation, muscle loss, and eventually arthritis. And here you can see how the ligament is getting trapped, the meniscus is getting trapped, and how the body is laying extra scar tissue towards the inside to help with the stability. One of the ways we diagnose cruciate ligament tear is by checking for the same abnormal movement in the knee. When the dog is relaxed under sedation, we stabilize the femur and gently move the tibia. If the shin bone slides forward abnormally, this is called a positive drawer sign and is one of the classic findings associated with a cruciate ligament injury. So one of the reasons we do a sedated exams is to confirm the diagnosis of the cruciate. Once we have confirmed the diagnosis, we obtain specialized x-rays. These x-rays help us evaluate the joint, assess arthritis, and then plan the TPLO procedure. Unlike human ACL surgery, we do not replace the torn ligament. Instead, we change the biomechanics of the knee itself. To understand the TPLO, it helps to look at the shape of the top of the tibia. In dogs, the tibia naturally has a slope or a plateau. When the cruciate ligament tears, the rounded ends of the femur tends to slide down that slope, creating instability. The goal of TPLO surgery is to flatten that slope, somewhere around 5 degrees. By changing the angle of tibia, we eliminate the forces that causes the shin bone to slide forward. As a result, the knee becomes stable again, even though the cruciate ligament remains torn. So in this x-rays, you can see that that plateau or the slope is 27 degrees. We're going to make it 5 degrees. How do we do that? We do that by carefully planning a cut on the bone of tibia. So we find the part where there are no vital structures and we go through and through with a very similar looking blade and cause a fracture in the tibia, also called as osteotomy. Now, after that, the top segment of the bone is rotated to achieve the desired angle and then secured with a specialized bone plates and screws because we want this bone to fuse in the new spot. For that, we put the plates and the screws. Once healing occurs, the knee functions much more normally and most dogs return to comfortable weight bearing and active stage when the angle on top of the tibia is more or less 5 degrees. When the dog puts the weight on that leg, the shin bone does not slide forward, which leads to comfortable weight bearing and activity level. It is important to understand that TPLO does not create a brand new knee. Okay, so the dogs that tear a cruciate ligament will still develop some arthritis over time. However, by restoring this stability, we significantly slow down the progression of arthritis and improve the comfort, function, and the quality of life. For this reason, TPLO is considered one of the most successful and widely performed orthopedic procedure in dogs. This is how it will actually look. In the left, you can see the slope on the tibia. On the right, you can see a flatter top with the TPLO plate placed in there. At LifeCare Pet Hospital, we understand that deciding on surgery for your pet can be a little bit overwhelming between good places to do, cost effectiveness, good price point, good value. Our goal is to help you understand this condition and answer your questions and guide you through every step of the process. We have one price for the TPLO, which includes your consult, blood work, surgery, x-rays after the 8-week x-rays after the surgeries. If you have questions about whether TPLO is right for your dog, we would be happy to discuss your pet's situation and help you make the best decision for your pet. Thank you.